welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about association of diabetes medication with open-angle glaucoma, age-related macular degeneration and cataract. Although diabetes was clearly associated with cataracts, diabetes medication was not. This has been suggested by a recent study published in JAMA Ophthalmology. Recent studies suggest that the diabetes drug metformin has a protective effect on open-angle glaucoma and age-related macular degeneration. However, studies have not addressed the critical issue of confounding by indication, and associations have not been evaluated in a large prospective cohort. The aim of this study, conducted by Joel E. Vergrossen et al., was to determine the association between metformin and other diabetes medication with open-angle glaucoma, age-related macular degeneration, and cataracts in the large prospective population-based Rotterdam study. The authors wrote, "We also examined the association between untreated type 2 diabetes with these eye diseases to investigate potential comorbidity. The longitudinal study design allowed us to determine type 2 diabetes and medication use before the onset of eye disorders and provided the potential to study their cumulative lifetime risks. This cohort study included participants from 3 independent cohorts from the prospective population-based Rotterdam study between April 23, 1990 and June 25, 2014. Participants were monitored for incident eye diseases and had baseline measurements of serum glucose. Data on diabetes medication use and data from ophthalmologic examinations were gathered. The exposures given were type 2 diabetes and the diabetes medications metformin, insulin, and sulfonylurea derivatives. This study included 11,260 participants. The researchers noted that type 2 diabetes was diagnosed in 28.4% of participants, open-angle glaucoma was diagnosed in 4.4% participants, age-related macular degeneration was diagnosed in 17.6% of participants, and cataract was diagnosed in 37.3% of participants. Untreated type 2 diabetes was associated with a higher risk of open-angle glaucoma, age-related macular degeneration, and cataracts. Type 2 diabetes treated with metformin was associated with a lower risk of open-angle glaucoma. Other diabetes medications were associated with a lower risk of age-related macular degeneration. The cumulative lifetime risk of open-angle glaucoma was lower for individuals taking metformin than for individuals without type 2 diabetes. The lifetime risk of age-related macular degeneration was lower for individuals taking other diabetes medication. The authors concluded that treatment with metformin was associated with a lower risk of open-angle glaucoma, and other diabetes medication was associated with a lower risk of age-related macular degeneration. Proof of benefit would require interventional clinical trials. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.